So in summary, kind of what we looked at today, in backwards fashion of what we've talked about, why does some of this kind of fascial mobility really improve? Why does it work in terms of trying to institute modalities to improve space and improve mobility? Well, if you're looking at yonder, you're going to kind of break up some of the tonic type facilitated muscles and hopefully increase the firing of those phasic muscles, the ones not doing their job. Okay? You can also decrease some of the stickiness, the densification in each of those layers. If you're thinking about that Thomas Meyer or the monkey hanging from the branch, right? You can decrease some of the stickiness of each of those little segments that is getting sticky. Okay? If you're thinking about trigger points, some of the knots that we touched and thought about earlier, then you can bring in more blood flow, flush out some of the things that aren't supposed to be there, get improvements in metabolism in the local area. And then really importantly, I think, is increasing that mobility. Remember the catch-it bottle with George, right? Trying to put energy into the system to get resistance out of the system so that you can move more freely, okay? Because until you do that, your motion is going to be restricted and impeded because there's a resistance in the system. You have to put energy into that somehow, either moving more or foam rolling or doing suction cups, doing that myofascial decompression, or even just kind of stretching more and doing yoga so that you can get a decrease in that viscosity of the ground substance, hopefully, okay? So think about decreasing your viscosity, and remember, at the same time that you move more and you do all these things, you change the way your body feels, right? You're changing the pain that the central nervous system interprets as bad, and you're changing it into things that feel good, okay? And that's really the take-home message of it. And we have to look above and below and front to back and which muscles are doing their job and not doing their job, because at the end of the day, where your pain is not usually the root of the problem to begin with. The root of the problem often is somewhere else, because mostly where the pain is a secondary compensation.